Hi and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. Today I'm going to be talking about how to discuss D.I.D. with kids. This is especially useful for parents, but it could be useful in many different situations. The material that I'm going to be discussing today comes from clinical experience. So this is from working with parents who have kids and trying to work through the pros and cons of how to discuss this with their kids. The timing, the appropriateness, all of those things. So I'll go through 5 things that I think are really important to consider, as well as some sort of safety messages and a few bits and pieces that I think might be useful. Firstly, as with all of these, I would say that it's best done following conversations in therapy. So if you are a person who has kids and you want to work out when to discuss this with them and how, discuss this with your therapist if you're able to. It's really important that you feel confident and supported to do this, and sometimes in therapy that means you can also do some role playing so that you could actually have the therapist being one of those kids so you can practice working a script out if need be. The first point is that talking about D.I.D. with kids does not mean talking about trauma. I think it's really important that we don't try and tell kids too much information about why a parent or person might have D.I.D, especially if it's coming from a very traumatic set of experiences that the adult might have, that you do not need to discuss any of those. There are many different things you can say rather than actually talk about anything specific, because again, depending on the age of the children, this might be something that you'd rather wait until your kids are a lot older to be able to discuss that with, especially if it's something to do with abuse, for example. The second one is being age appropriate. You ideally need to know what the kids are capable of understanding at any given time in their lives. So you might want to use different tools, toys, media references, diagrams, ways of explaining that are appropriate to the age of the child. And realistically, this comes down to knowing the kids well, and if they are your children, you're explaining to them, you will have a good sense of what it is that they're capable of understanding and the best way in which they can understand it, whether it's a visual thing, whether it's a verbal thing. Does it need to be tactile? Do you need to have sort of toys, models, things like that that will help them understand this? And like I said, media references are really good in helping kids being able to think about films or TV shows that they like, and you can use those as a way of explaining. Try and do it in a way that conveys a confidence in it. It's really necessary to not scare kids. So if you are scared or you are stressed out by the D.I.D, that probably is not the right time to be discussing that with kids. They need to feel that you're in charge, that you're in control. So telling kids about D.I.D is definitely not about trying to scare them and telling them how horrible and awful it is, but telling them that it's simply a thing that you have that they could do with understanding. So being in charge of that process, being calm, being relaxed is going to be one of the sort of the key parts of this. Ultimately, anything that scares you is likely to end up scaring your kids. Think about how kids learn phobias through social learning, for example. As I discussed in my video on my phobia, that I picked that phobia up from observing my dad having that phobia. So kids get scared of the things that their parents are scared of. So if you're confident and you're calm about the D.I.D, then they can be confident and calm about the D.I.D. The fourth thing is to be honest about it. Kids are really good at knowing when parents are lying or leaving something out. If they're seeing things going on at home, it's entirely likely that they're going to be asking their own questions anyway. And if you lie or if you pretend that absolutely nothing is happening whatsoever, they're going to know something's up. And if they think that this isn't anything that they can know about, so your level of dissociation, then you're trying to deny it or hide it from them, it's only going to make them more curious or think that it's so bad they can't know about it. And again, you're then into the territory of them potentially being really scared or stressed out by the thought of this thing happening that they're not allowed to know about. My guess is that if your kids are of a certain age, then they're going to know that something is different about you at certain times. And they're going to already be constructing their own narrative about this, so why not actually just be really honest and help them understand in a really good, appropriate way to explain what's going on in a way that they're not going to be scared by. And the fifth thing is you can help them be involved. Think about many other different health conditions that a parent might have. So it could be epilepsy, it could be allergies, could be diabetes. There are many things that kids can do that actually are really involved in helping the adult. So if the adult's having an allergic reaction, it could be that the child knows to get the EpiPen, or they have to tap a direct dial on a phone in order to get assistance. Lots and lots of different things that kids can actually do that's really safe and really beneficial to them. Kids like helping. Many kids want to feel that they are involved in their parents' life. And again, if they're not scared and they're not stressed about these things, then you can help the kids understand that there are things that they can do. For example, if you have ulcers with different names and the child is aware that some of those parts might come out, some of those ulcers might come out at different times, they can learn the names and they can use the names, and maybe they can ask for you back, or they can just be really calm and interested. It could be that they can do some play, it could be that they can be involved in somehow to ask what those parts might want. So don't be afraid of getting them some knowledge about the dissociation. It's not going to be that that's going to cause them problems, and you're not using them as therapists. So do remember that explaining about D.I.D. to a child or an adolescent is not meaning that you're going to then use them to become your therapist to make it all go away or make it all better. You've got to be aware that these are kids and they need a framework for understanding. The therapy is done in the therapy room with a trained therapist, but kids are part of life, and if D.I.D. is an important part of your life, then those two things need to be matched up. Do remember that if the kids are loved and they're safe, then they'll cope. And as I said, it'll be no different to any other health condition. If you had epilepsy, you'd need to let the kids know about that. If you had panic attacks because of phobic responses, you'd need to know about that. If you had obsessive compulsive disorder, they're going to see these things, they're going to watch these behaviours be played out. I think it's really important that they understand what's going on. And if you do it in a way that doesn't scare them or stress them out, then they can be very, very clued up and understanding what it is. And actually many kids come out of environments with parents with health problems or different conditions or illnesses or whatever, whether it's physical health or mental health, and they do fine as a result of that. There's no reason why a parent with a health condition should cause harm to that child by virtue of telling them about that health condition. Some parents that I've spoken to worry that by telling the kids about D.I.D. it means that somehow the kids can get D.I.D. Dissociation isn't like that. It's not a virus that can be passed from one person to another like a cold germ. If you've got dissociative identity disorder, it's because of a specific set of circumstances that happened early in your life. If those circumstances are not being repeated for your children, there's no reason why they should pick up D.I.D. as if it's like a bug, for example. Your kids might be so interested in it that they want to have D.I.D. That's an interesting thing for some parents to have to deal with, that kids might want parts because it makes them seem different or unusual or creative. Don't worry about that. Their imagination is going to run riot if you tell them about these kind of things, depending on the kid. But they're not actually going to get D.I.D. as a result. It's not possible to catch D.I.D. as a child because a parent has it. If that parent is well controlled in their dissociation, and if they can manage it and they can look after it, and in a way that it is not completely and utterly chaotic, then that child is going to have a very, very good chance of understanding what's going on and be useful and be helpful to you as a result. This is about the development of curiosity and empathy. These are things that I've talked about in other videos on the channel, that I want people to be curious about dissociation and to have an empathy for it, rather than feel stigmatized or feel it is something is wrong or terribly unpleasant that's going on. That's simply not the case. We just got to make sure that kids aren't being frightened by the level of trauma that a person might have experienced, so you keep the description of the why well away until those kids are old enough to be able to truly understand what that stuff means, if ever. One thing about D.I.D. is that a lot of good things can be done with it without needing to really get into the why of it. Trauma exploration is left to a different phase of therapy. Part of discussing and part of communicating D.I.D. to others, including kids, is all part of the stabilization process in many cases. Sometimes dissociation and D.I.D. can be scary to witness. You could be dissociating into an angry part, or a part that might want to self-harm. So if kids are in the house, obviously there are issues of safeguarding around this. So it's going to be really important for that person, and possibly you, to be highly motivated to be in charge and to regulate this level of dissociation. Again, this is why being in therapy is so important, because you need the support and help to be able to establish that level of stabilization as best as you possibly can do. However, and this is conversations that I've had with GPs and with parents with kids, they're scared that they're going to lose the kids by sharing the dissociation, by it being evident, or the kids witnessing some form of dissociation. In my clinical experience working with parents in these situations, actually the dissociation manages itself. It's like an intuitive control behind the scenes that the alters, the parts, the others know not to come out around children if those kids are going to be scared by the experience. Obviously this isn't a guarantee, but I've seen this done time and time again, where the actual level of dissociation drops enormously when that parent is alone with the child. It's like they know better. The system knows not to offload all of that dissociation onto the kids. Could be that when the kid is then looked after by a different person that the dissociation happens. That might well be the case, but I think it's really important that there is confidence within this. But at all times, this is about monitoring and checking and being aware that whatever is going on for you as an individual with D.I.D, that is not then being translated to children in a harmful way. And again, this is about discussing in therapy as much as possible. So doing this shouldn't scare you. It should be an important part of the therapeutic journey with D.I.D, but there are really good safety messages to hold on to, and I'll put a summary of these up on the screen for you. So to make sure that these sort of 5 points and the safety messages are understood and built into that communication as best as they possibly can be. I hope that this has been a useful video for you. It's something that was requested many times on the channel by comments and people getting in touch with me and asking about this. So I hope I've done the subject as well as you would have hoped. Clearly I'm not going to have contained every single message that could possibly be considered within this. I hope I've done the best that I can do. So thank you very much for watching the channel. Obviously please leave comments, like and subscribe, and look after yourselves. So take care, and I'll see you soon.